My name is Allison Sanders, student ID number 3266053, and this is my AVMA video for clinical pathology. I'm going to go over how to do a fibrinogen assay today. So I'm going to start by taking 2 of my hematocrit tubes. And then I'm going to fill them equally with blood. And you want to fill them about 3/4 of the way full. Go ahead and dab twice in the clay. And do the same thing with the other one. And then go ahead and recap your needle. And then you're going to want to go ahead and centrifuge these. So for our centrifuge, we go ahead and we spin it for 5 minutes on high, and then we'll come back once they're done being centrifuged. Once they're done centrifuging, you're going to go ahead and take them out. And you're going to set one to the side. And with the other one, you're going to get the total solids of it, so you're going to use a refractometer. You're going to break it and dab a little bit on it. And then you're going to shut it and look at a light. Okay, so this is 7.3, and then with the other hematocrit tube, you're going to go ahead and incubate it in a 58 degrees Celsius incubator for 3 minutes, and then we'll come back after it's done being incubated. Alrighty, so after this hematocrit tube has been in the incubator for 3 minutes, you're going to go ahead and re-centrifuge this. So again, I'm going to centrifuge it for 5 minutes on high for our machine, and then we'll come back once it's done being re-centrifuged. Alrighty, after we re-centrifuge this hematocrit tube, we're then going to go and go ahead and get the total solids of this one as well. So same thing, break it, and then you dab a little in the refractometer. Close it, look up at a light. Alrighty, and the total solids of this one is 7.4. Alrighty, now that we have the total solids of both, what you're going to go ahead and do is multiply them by 1,000. So for the non-incubated one, it was 7.3 times 1,000. 7,300, and for the incubated one, the total solids was 7.4, so that multiplied by 1,000 would be 7,400, and that gives you the grams per deciliter. And so to find the fibrinogen determination, you're going to go ahead and take the number that you got for the non-incubated total solids, which is the 7,300, and you're going to subtract that from the total solids that was taken from the incubated one, which was the 7,400. And you're going to equals -100, and that gives you the milligrams per deciliter. Alrighty, so today we're going to go over how to do a heartworm test or an ELISA test. So I had already labeled my blood with the patient's name, the date, and their ID number. So now I'm going to go ahead and put it in our book, which is where we keep track of all the heartworm tests that we do. So I'm going to go ahead and write today's date, which is the 24th, and then write her name. Set that off to the side, and then I'm going to go ahead and open up my ELISA test. The actual test itself, I'm going to label the side with her name, just in case if we have more tests going on at once, I know which one is mine. So her name's on the side. And then already comes with the pipette. So what you're going to do is take 4 drops of the conjugate, place it in here. And then take 3 drops of the blood from the purple top. 3. Going to invert it a few times, and then go ahead and drop it on the hub of the ELISA test. Alrighty, and then it'll start making its way down. Once it gets to the little hub at the bottom, you're going to go ahead and snap it, and you're going to run it for 8 minutes, and then I'll come back once the 8 minutes are over. Alrighty, so after the 8 minutes, the beeper went off, and so this is what it looks like. This is the control dot, meaning that everything worked. So this patient is negative for heartworm disease as well as 3 tick-borne diseases, Lyme, Ehrlichia, and Anaplasma. If he was positive for anything, another dot would show up in response to the specific spot on where it would be on here. But she is all negative, so that's why you only have the control dot that popped up. So now that I know she's negative, I'm going to go back to my sheet of where we write everything, and I'm going to put negative times 4 because she's negative for all 4 things that this tests for. And then I just go ahead and write my initial, and then I will go ahead and let the doctor know and put it in the computer. Alrighty, so to perform a heartworm direct smear analysis, what you're going to do is take your blood from your anticoagulated or EDTA tube, and then I have a pipette just to place the drop of blood. You're going to go ahead and get a slide out, as well as a cover slip. So what you're going to do is you're going to take your slide, set it down, take your tube, pull up a drop of blood, place it right in the center of the slide, and then you're going to go ahead and place a cover slip over top of that. And it will look something like this. And then you're going to go ahead and take a look under the microscope and see if you can see any microfilariae. Alright, once you're ready to look under the microscope with it, you're going to go ahead and stick it on there. And at first you're just going to look at it with the 4-power magnification just so we can focus it and get it all set up. Once you have it focused, you're going to go ahead and change it to the 10-power magnification. And when looking for any heartworms or anything, you're going to, they'll have like a stationary squirming and like twisting movement. So you're going to go ahead and make sure you cover every field of the slide. See if you see any. Alrighty, and after examining every field of the slide, I'm not seeing any microfilariae, so that would indicate that this patient does not have any heartworms. So I'm going to go ahead and write it in her chart and then go ahead and let the doctor know. Today we're going to go over how to do an in-house blood chemistry panel. Unfortunately, we haven't had any animals that have needed to do in-house blood, so I'm going to show you how to do it using a quality control, pretending like this is the blood sample that we're going to be using. So first and foremost, I'm going to go to the instruments, and I'm going to hit counts 1 because that's what we're going to be using for the blood work. And then I'm going to go ahead and go to maintenance since we are doing the quality control. And then I'm going to click the quality control button, wait for that to pop up, with this, you need to make sure you match up this number with this. So the number is Q7122. So I will go ahead and choose this one that matches it and run quality control. Since we're doing quality control, you first have to clean the machine before you go ahead and do it. So I will come back once the machine is all cleaned. Alrighty, so now that the machine is done cleaning, we're gonna go ahead and put everything in. So you're gonna open up all this. You're gonna make sure all of those are filled. You're going to take, this would normally be your blood sample, but for us, we're just using the control. You want to go ahead and take the perfect amount like this. Stick it in your sample cup. Go ahead and place that there. And then you go ahead and put the lights down first. And then you open up the quality control. And you go ahead and shut that. Hit done. And then you go ahead and press the button next to it. And it should be able to go. Alrighty, so now that it's all done and running, the results pop up over here. So you can go ahead and click it. And then you hit view. And everything is in the normal range as it should be since it was the quality control. Now, if you were doing it on an animal who was presented for something sick or anything like that, there would be some lows and some highs and some abnormalities with the blood work and everything like that. But since this is just a quality control, everything should be in the normal range, so it's good that it is. Alright, so since we did the quality control and it wasn't an actual blood sample of a patient, if we had to go ahead and do that to get it to pop up here, we can either put it in our AVMA system and it'll link it over here and it would pop up over here. Or you can go to analyze sample and add a new patient and it'll go through. You have to add the patient name, the ID, whether or not they're a feline or a canine, and it'll go through all the steps. And then once you do that, it'll pop up over here and you can go ahead and click it and it starts running the blood work. And again, once it's done, it'll pop up in the in-house results.